lowers the spirit, brings you out in plooks.
No! Well, it screws up your emotional sensibilities.
I suppose so.
It has mine. Right up. And what would happen if one of us, or one of these obliging and charming young ladies we keep meeting in our game of musical beds, was suddenly to develop a dose of gram-negative intracellular diplocockia? The clap.
Gonorrhea starts here.
And ends up here and here. It's back. We slicket current temerous beastie. I like mice. Better than cockroaches.
At least we've got a choice here. Maybe the mess committee could clear it
Our
up.
committee kills my mice over your dead body.
OK, we'll keep the mice.
And massacre the cockroaches!
Are you all right?
No.
Did you have a lot at the party?
I didn't feel like it. I'll be all right.
Someone gets my message in a bottle. Yeah. Message in a bottle. Yeah. I should have known this right from the start.
Place that's getting me down.
Where are you going next? For surgery?
Yeah, here.
Me too.
Probably a mistake. 12 months in this guest house.
There must be vacancies somewhere else. You feeling all right?
No. Why do you keep asking?
Your eyes. I think you've got it.
What? Hepatitis, yes, but nobody's saying what kind.
So why not serum hepatitis?
Because it isn't that, he's antigen negative.
You seem to know a lot about it.
I have my sources.
So it could still turn out to be the same as Ted's?
If people actually knew what that was. I suppose we'll just keep going through the alphabet. Hepatitis A from bad drains, hepatitis B from blood and blood products, and this will be C, D, E, F, or G, depending how far they've got.
What about non-A, non-B?
Suter's probably more worried about what's going to happen than what it's called.
I'm more worried about where it's coming from.
Maybe you get it at parties like hangovers. I mean, that's how Suter got it.
The President and members of the winter mess of the Royal Charitable Institute Residency invite you all to a party. Drinks, eats, and hepatitis will be served.
Another of your patients died, Dr. Campbell. I've just gone off duty too. I have to stay on and do the body. But there's only a wee third year in charge and, of course, that Nurse Wallace. You know the one? That's two now. Do you think there's something wrong with this lot, Dr. Campbell?
Perhaps.
You think so? Well, I hope not. The other two are quite nice. Well, Mr. Gavin is. Heard the other one talking dirt to an auxiliary. And him maybe at death's door. Well, what do you think's doing it, Dr. Campbell?
Aren't they all constipated?
You don't die with your heart if you're constipated, do you?
It's a thought.
You mean us clearing them out could have something to do with it?
It's hard to tell.
It's basic nursing care.
Could Lancasters really be bumping off the coroner?
I shouldn't have thought so, no. Except in a mad, scientist, speculative sort of way. It is conceivable that you could get some sort of fluid and electrolyte upset, but basically no.
So you were just getting rid of her?
You could go far in medicine.
Poor old Suter.
What's wrong?
Nothing, I think. Oh, but they keep bothering me.
Wound?
Don't think so.
UTI?
No. Look, you're as bad as they are. The breezes are lovely, thanks. How's the ward?
Sister's really awful today.
Is she?
Yes. We ran out of syringes this morning. She's pathetic. I'm beginning to wonder who organises things when you're both there.
She was up. Mentioned she'd be glad to have me back.
Do you order things, usually?
Often, yeah. Usually.
And who makes up the off-duty?
Me, usually, I suppose.
What does she do when you're on together?
Well, she teaches the juniors.
But you teach the juniors.
Sometimes.
A bright lot up there just now.
Yeah, sister was full of them. Especially the skinny one with long dark hair, Wallace.
Really?
Yes, they were on late together yesterday.
Really?
Quite a precocious child from the sound of things.
Really?
Thanks for the freezes.
I hope you're all right, son. It's been ages.
I'm doing my best. Things are settling down now. They're starting to talk about convalescence.
Oh, really?
I think I'd rather go home.
The flat?
No. Home.
Biscuit freezer? Oh, thanks awfully, Ronnie. Very good. A good weekend? I would have been all right except for wee Karen's teeth. Oh, I am sorry. Teeth can be such a bother. How was your weekend? Well, we ran out. Oh, I should have said, papering the breakfast room with an end lot of biscuit Regency stripes. Awfully nice, terribly cheap. But we ran out.
I'm terribly sorry.
All right, sister.
I'm terribly sorry, Doctor.
Morning, sister.
Such a squeeze.
Coffee, sister?
Oh, thank you. Thank you.
Sister, we seem to be a bit low on 20 ml syringes.
20 ml syringes?
We haven't got any, but maybe you've ordered some.
Oh, yes, I think so. I hope so. But I just... Let me check. Sorry, Doctor.
Really, David? No wonder she gets upset.
I'm afraid he arrested over the weekend, sir. Sunday evening. No luck with resuscitation.
Dear. And there was that other one of mine, the one I didn't even see, the poor man who arrested on Thursday.
Yes, sir.
Oh, dear. Yes, I wonder what's doing it.
It occurred to me, sir, that it might have something to do with our laxative policy.
Laxative policy?
Yes, sir.
I wasn't even aware that we had one. Of course, that sort of thing's generally left to the nursing staff, but then that might be quite anomalous.
It occurred to me, sir, that these laxatives might cause just enough potassium disturbance to tip off something dangerous in the heart. Perhaps even ventricular fibrillation?
Like cholera. Yes, I remember Highland Light Infantry RSM in Penang.
Yes, sir, like cholera. Perhaps a less drastic shift in potassium, but still fatal for these people with coronaries.
Yeah, I don't remember seeing that in print.
The cholera-potassium thing's well documented, sir.
Yes,
I think I see what he's trying to get at, sir. A purgative-induced potassium shift inducing fatal hyperkalemic arrhythmias after recent coronary thrombosis.
It sounds good, Ronnie, but it won't be all that easy.
We'll need total body potassium, sir, so that means getting the isotope people in for balance studies. But the point is, sir, that it's an internal shift from blood to gut. Therefore, these balance studies of yours would prove nothing. But I'm sure we can solve it. Half-hourly blood samples, gut samples too. Half-hourly, that is, from long tubes, top and bottom, if you follow me. Because we need a picture of potassium shifts in the gut as a whole.
But Ronnie...
So we'd need 25 coronaries getting the usual laxatives and 25 getting none. So, with 100% patient cooperation, I'm sure we could get the whole thing wrapped up in 3 months.
Well, what more proof do you want? I mean, 2 out of 2 is 100%. I take it they both had laxatives.
Don't you think, sir, that multiple blood sampling and tubes in both ends might be a risk to patients who've just had coronaries?
Surely, sir, we have to pinpoint a major cause of death in a common disease.
Well, maybe, but I have no doubt at all that we must be taking a good look at the way laxatives are being used. I mean, they can't just be handed round like dolly mixtures.
With perhaps fatal results.